Hello and welcome along to another See Jason podcast. My name is Nazem Akoum, and it is my pleasure to discuss with you on behalf of my co-authors our newest publication in the journal entitled Rates of Cardiac Rhythm Abnormalities in Patients with Chronic Kidney Disease and Diabetes. The purpose of this study was to study the occurrence of arrhythmias in a population of diabetic patients with moderate to severe chronic kidney disease. This question has been studied previously in patients with end-stage kidney disease who are on hemodialysis, but not in patients with CKD who are not on hemodialysis. The source population for this study was participants enrolled in the CANDY study, which is a prospective study of patients with type 2 diabetes and moderate to severe chronic kidney disease with a range of eGFR from 6 to 100 milliliters per minute per 1.73 meters squared. We recruited patients in the CANDY study to wear continuous ambulatory cardiac monitoring using a mobile cardiac telemetry monitor called SEEK for up to 14 days. All cardiac arrhythmias were adjudicated by myself, a cardiac electrophysiologist rhythm specialist. We evaluated participants for various rhythm abnormalities, including supraventricular and ventricular arrhythmias, such as premature atrial, junctional, and ventricular beats, supraventricular and ventricular tachycardia, atrial fibrillation, as well as conduction abnormalities, including different forms of atrioventricular conduction block and ventricular pauses of greater than 2 seconds. We recruited 38 patients into the study, 37 of whom were women. Participants wore the heart monitor for an average of 11 days. Cardiac arrhythmias were detected in 18 of the 38 patients for a total of 104 episodes, or 88.8 episodes per 100 person years. The most common arrhythmia detected was atrial fibrillation, which was detected in 6 patients and was a new diagnosis in 4 of these patients. Risk factors identified to be associated with higher arrhythmia detection rates included older age, higher body mass index, known cardiovascular disease including coronary disease, heart failure, and stroke. And lastly, beta blocker and non-dihydropyridine calcium channel blocker use was associated with a higher arrhythmia detection rate. This is a relatively small study, but it provides some important takeaway points. We mentioned 3 of those. Number 1, the rate of arrhythmia in this high-risk population of diabetics with moderate to severe chronic kidney disease is high. Number 2, all arrhythmia episodes detected in our study were not associated with any symptoms. And lastly, number 3, atrial fibrillation was the most commonly detected arrhythmia and was undiagnosed in 11% of the population. Subclinical cardiac arrhythmias may be important precursors to clinically significant cardiovascular events, including sudden cardiac death. We believe that our study opens the door for future, larger studies, which are needed to evaluate the utility of early detection and treatment of these arrhythmias in this large population.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.